Fridays in the South mean just one thing: high school football. But no matter what sport is being played, if a player gets hit, especially in the head, Dr. Sarah Waling says the concern for concussions should stay top of mind, including recent changes and recommendations.
The most recent data has actually shown us that kids do not have to have like this rest period where they're not doing anything. Historically, we had said that if your child has a concussion, they need to stay out of school. They don't need to be reading. They don't need to be doing activities. The new recommendations is that within the first 48 hours of a concussion, if it's tolerated, a child should do light exercise. So they should be walking. They should be at school. We do want to withhold screen time or limit screen time, though. That is one thing that has kind of stood the test of time.
And if a hard hit happens, Dr. Waling says to watch out for these signs.
The red flags that we should look for: loss of consciousness, meaning that a kid had an injury and they did not immediately get up or they didn't respond. If they are having dizziness, if they are vomiting, if they are having trouble with their vision, all of those are, let's get seen by a doctor immediately. That is not something where I say, see your physician in the morning.
According to Dr. Waling, symptoms may not appear right away, which is why it's important to monitor children closely after any head injury.
Very rarely does anything beyond watching and waiting have to happen. And you have to kind of allow the brain to heal.